Have you ever felt a knot of worry at the thought of surgery now that you're over 70? Maybe it's the fear of not waking up from anesthesia, or the daunting prospect of a long, painful recovery that weighs on your mind. You're definitely not alone. Surgery after 71 is very different from what it was in your younger years. Your body heals more slowly, your risks increase, and if you're not fully prepared, the recovery can take a serious toll, not just physically, but mentally too. But here's the encouraging news. There are 7 crucial steps you can take before your operation that will help you recover faster and avoid dangerous complications. Many people don't know these tips, and skipping even one can lead to setbacks that impact your independence, your mobility, or even worse. So stick with me through this video. We'll walk you through exactly what you need to do before surgery so you can feel confident, prepared, and in control at every stage. Whether you're facing a hip replacement, a heart procedure, or even a minor operation, this could be the most important video you watch today. Before we dive in, I'd truly appreciate it if you like this video. It really helps me continue sharing valuable lessons for healthy aging. If you haven't subscribed yet, I highly recommend subscribing and turning on the notification bell so you don't miss any future videos. And if you find this helpful, please comment 1 below. If not, comment 0 so I can improve for you. Now, let's get started. First, get a full health evaluation, not just the usual pre-op tests. Before undergoing any surgery after 70, it's essential to go beyond the basics. While most hospitals will check your heart and lungs, you need a comprehensive assessment to identify hidden risks and optimize your overall health for surgery. Seniors require a far more comprehensive evaluation than just basic heart, lung, and blood tests. Why? Because aging bodies are incredibly complex. Even minor health issues can dramatically influence surgical outcomes. Many older adults live with multiple chronic conditions such as diabetes, high blood pressure, arthritis, kidney problems, or early-stage cognitive decline. These aren't just background details. They play a significant role in how your body responds to anesthesia, your risk of experiencing delirium after surgery, and how quickly and safely you recover. Medications also deserve careful attention. Many seniors take several prescriptions every day, and certain combinations can interfere with anesthesia or increase the risk of bleeding, infections, or confusion following surgery. Even over-the-counter supplements like ginkgo biloba, garlic, or fish oil may pose risks if not fully disclosed to your medical team. Another crucial but often overlooked factor is nutritional status. Malnutrition is surprisingly common among older adults, even those who appear well-nourished. Poor nutrition can slow down the healing process, weaken the immune system, and increase the likelihood of post-operative infections. Mobility and mental function should be part of the evaluation as well. Seniors with limited mobility or signs of mild cognitive impairment tend to have longer hospital stays and may face more challenges during post-surgical rehabilitation. Identifying these risks early allows your medical team to set up the appropriate support systems well ahead of time. So, what should you do? Ask your doctor specifically for a geriatric preoperative assessment. This is a tailored evaluation designed to address the unique needs of older adults, giving you the best possible chance for a smooth and safe surgery. This specialized evaluation typically includes screening for frailty, measuring strength, energy levels, and overall resilience. Cognitive testing helps identify any early signs of memory loss or confusion, while a fall risk assessment reviews your balance, gait, and history of previous falls. A thorough medication review checks for harmful drug interactions or unnecessary prescriptions, and a nutritional evaluation screens for hidden deficiencies that could slow down your healing process. The insights gained from this comprehensive assessment enable your medical team to anticipate potential complications and craft a personalized care plan, not only for the surgery itself, but also for your recovery period. Don't settle for the standard "you're cleared for surgery" message. Instead, insist on a full, senior-focused evaluation that truly prepares you for the best possible outcome. If you're still watching this video and finding these lessons useful, please comment 1 below to let me know you're with me. Thank you for your valuable time. Next, it's crucial to understand the risks anesthesia poses for older adults. Anesthesia is not a one-size-fits-all solution. As we age, our brain, liver, kidneys, and cardiovascular system undergo changes that affect how anesthetic drugs are processed. What may be safe and routine for a 40-year-old can carry significantly greater risks for someone in their 70s or beyond. One of the most serious concerns is post-operative delirium, a sudden state of mental confusion that can last for hours or even days after surgery. Seniors experiencing this may become agitated, disoriented, or unusually quiet and withdrawn. In some cases, this confusion can lead to falls, extended hospital stays, or even a permanent decline in cognitive abilities. For seniors showing early signs of dementia, anesthesia can sometimes accelerate cognitive decline. Another condition to be aware of is post-operative cognitive dysfunction, or POCD. This is a more subtle but long-lasting impairment where thinking, memory, and attention are affected for weeks or even months after surgery. Studies show that older adults, especially those over 70, are particularly vulnerable to POCD, and in some cases, they may never fully regain their previous level of mental function. Several sharpness factors can increase the risk of cognitive issues after surgery. These include pre-existing memory problems, even if they seem mild, taking multiple medications, a history of strokes or multiple strokes, long or complicated surgeries, and the use of general anesthesia, especially when it's not carefully adjusted for your age. So, what can you do before surgery to minimize these risks? Have an honest, open conversation with your anesthesiologist. Make sure to share any history of memory problems, confusion, or cognitive decline, no matter how minor it may seem. Then, don't hesitate to ask some important questions. Can regional anesthesia, such as a spinal or epidural block, be used instead of general anesthesia? Regional options are often safer for older adults and typically come with fewer cognitive side effects. Is light or twilight sedation an option for my procedure? Sedation tends to be less taxing on the brain than full general anesthesia, yet it still keeps you comfortable. Will you be monitoring me for signs of delirium or memory problems after surgery? Some hospitals now include post-operative cognitive monitoring as part of their geriatric care protocols. Can we minimize or avoid the use of anticholinergic medications or sedatives? These drugs are known to cause confusion in older adults and should be used sparingly or avoided if possible. An experienced anesthesiologist will customize your anesthesia plan based on your age, body weight, kidney function, and overall health. Their goal is to reduce risks while ensuring your comfort. Finally, it's invaluable to have a trusted family member or caregiver advocate for you before and after surgery. Someone who can observe any unusual behaviors or mental changes and report them immediately. Being informed about anesthesia and advocating for a safer, personalized approach isn't just wise. It could protect your independence, preserve your memory, and help you recover with greater peace of mind. Think of surgery as a marathon, not a sprint. Your body needs to train and prepare beforehand, a process known as prehabilitation. Seniors who dedicate a few weeks to improving leg strength, balance, and stamina before surgery often recover faster and face fewer complications like infections or bed sores. So, what can you do? Talk to your doctor about pre-surgery physical therapy. Even simple chair exercises, daily walks, and light resistance training at home can make a significant difference. Focusing on strengthening your legs and boosting your lung capacity will prepare your body for the demanding recovery ahead. Now, surgery preparation is much like training for a big race. You wouldn't run a marathon without conditioning, and similarly, your body shouldn't undergo major surgery without being in the best shape possible. This preparation is even more critical as we age because our bodies naturally lose muscle mass, flexibility, and endurance. These declines can slow your recovery, increase the risk of complications after surgery, and make it harder to regain your independence. But here's the hopeful news. Studies show that older adults who participate in rehabilitation programs focusing on strength, balance, and endurance experience shorter hospital stays, fewer infections, improved mobility, and a better quality of life after surgery. Even just a few weeks of intentional movement can strengthen your immune system, improve circulation, and make it easier to get out of bed or walk after the procedure. This proactive approach dramatically reduces the risk of bed sores, blood clots, pneumonia, and muscle atrophy, all common challenges for adults over 70 who spend extended time confined to bed. What should you do next? Ask your surgeon or healthcare provider about a tailored prehabilitation program designed specifically for your needs. Ask your primary care doctor for a referral to pre-surgery physical therapy. Many hospitals now offer prehabilitation programs specifically designed for seniors. These programs usually include leg strengthening exercises to improve your ability to walk and stand after surgery, balance training to reduce your risk of falls during recovery, breathing exercises or incentive spirometry to boost lung strength and help prevent post-operative pneumonia, and flexibility work to ease movement and reduce stiffness. But even if you don't have access to formal therapy, there are still effective ways to prepare at home. Try to take daily walks, even if it's just around your house or yard, to build cardiovascular strength. Incorporate chair exercises targeting your thighs, calves, and core. Things like lifting your legs, doing seated marches, or repeatedly standing up and sitting down from a chair to build leg power. You can add light resistance training using hand weights, resistance bands, or even soup cans. Don't forget to practice deep breathing several times a day to keep your lungs active and strong. Aim to start this routine at least 2 to 4 weeks before your surgery. The more consistent you are, the better your body will handle the stress of surgery, and the quicker you'll bounce back. Never underestimate the power of movement. Prehabilitation isn't just about getting fit. It's about giving your body the best possible chance to heal well, avoid complications, and return to the life you love as safely and quickly as possible. If you're still watching and finding these lessons helpful, please comment 2 below to let me know you're with me. Thank you so much for your valuable time. Recovery after surgery when you're over 71 can be a completely different experience compared to your younger years. While many expect to bounce back quickly, the reality is that aging bodies take longer to heal. Muscles need more time to regain strength, energy levels may stay low for several weeks, and the risk of complications, such as infections, blood clots, or even depression, increases with age. That's why thoughtful preparation before surgery isn't just helpful, it's absolutely essential. One of the most common post-surgery challenges for seniors is fatigue. You might find yourself needing more rest throughout the day, sleeping longer at night, or simply lacking the stamina to perform everyday tasks like standing for extended periods, walking to the bathroom, or even getting dressed. These aren't signs of weakness. They're a natural part of the aging and healing process. Being aware of this in advance can help you be kinder and more patient with yourself during recovery. So, what should you do? Start by asking your doctor about the recovery timeline you should realistically expect based on your age, overall health, and the specific surgery you're having. Will you be able to walk on your own shortly after? Will you need help with daily activities like showering or dressing? Will climbing stairs be a challenge? Knowing these details ahead of time will help you set achievable goals and reduce frustration. Next, plan the support you'll need. Think about who will be there to assist you in the days and weeks following surgery. Will a family member or friend stay with you? Or might hiring a home health aide be a better option? If you live alone, this step becomes even more critical. Many seniors find that having reliable support can make all the difference in their recovery journey. Some seniors benefit greatly from short-term rehabilitation in a skilled nursing facility, where nurses and physical therapists provide around-the-clock assistance with recovery. Others might only need simple aids like a walker, a shower chair, or handrails to safely return home. Planning ahead is key. You'll also want to prepare for nutrition. Stock up on healthy, easy-to-digest foods, or arrange for meal delivery through a senior nutrition program or local community service. If you have dietary restrictions, be sure those are carefully addressed in your meal planning to support your healing process. Don't overlook emotional support either. Recovery can often feel isolating, especially if your mobility is limited. Set up regular phone check-ins, encourage visitors to stop by, or join an online support group for seniors recovering from surgery. Staying socially connected is just as vital as physical healing. By organizing these pieces before surgery, you significantly reduce the risk of complications, prevent avoidable falls or accidents, and give yourself the best chance for a smoother, more comfortable recovery. Now, it's important to watch out for hidden risks, like infections and bed sores. After age 70, the body becomes more vulnerable to complications that younger people might bounce back from more easily. One of the most serious risks after surgery for older adults is infection. This can include wound infections, urinary tract infections, and even pneumonia. These conditions can develop rapidly and may worsen quickly if not detected early. In addition, seniors who spend extended periods in bed or sitting without sufficient movement face the danger of developing pressure ulcers, commonly known as bed sores. These painful skin breakdowns can lead to serious infections and represent a major challenge during recovery. Pressure ulcers, or bed sores, are a major concern during recovery, especially for seniors. Why is this such a big deal? For starters, aging skin is thinner and less elastic, making it much more prone to tearing or breaking open, particularly in areas under constant pressure like the heels, hips, or tailbone. At the same time, the immune system naturally slows down with age, so your body takes longer to fight off germs. Even a small wound can quickly become dangerous if it isn't cleaned and cared for properly. What should you do before you're discharged? Have a thorough conversation with your doctor or nurse about post-surgery hygiene protocols. Make sure you or your caregiver fully understand how to clean the surgical site, change dressings, and watch for signs of infection. These warning signs might include increased redness, warmth, swelling, pus, or a sudden spike in body temperature. Mobility is also crucial. As soon as your doctor says it's safe, start gentle movement. Even short, frequent walks, like pacing a few steps around your room or walking to the bathroom, can make a world of difference. Moving helps prevent pneumonia by keeping your lungs clear, improves circulation to help wounds heal faster, and reduces the risk of blood clots. Plus, it helps relieve pressure on specific areas of your body, lowering your chances of developing bed sores. If you're bedridden or need extended rest, ask your caregiver or nurse to assist you in changing positions every couple of hours. Using cushions or specialized mattresses can help relieve pressure on vulnerable spots. And most importantly, speak up if something doesn't feel right. Many seniors hesitate to bother the nurse or doctor, but reporting a fever, increased pain, or unusual swelling early can be the difference between a simple complication and a serious problem. By staying alert and proactive, you can dramatically improve your chances of a safe and smooth recovery, protecting yourself from some of the most dangerous post-operative threats. Early detection and treatment can be the difference between a minor setback and a life-threatening infection. If you're still watching and finding these lessons helpful, please comment 3 below to let me know you're with me. I truly appreciate your valuable time. Now, let's talk about something often overlooked but just as vital: preparing mentally and emotionally. Healing isn't just physical. When most of us think about surgery, we focus on managing pain, regaining strength, and avoiding complications. But for seniors, especially those over 70, The emotional and mental aspects of recovery are equally important. After surgery, it's common to feel emotionally drained, anxious, or even a bit lost. The temporary loss of independence, the disruption to your daily routine, and the uncertainty of how long recovery will take can weigh heavily on your mental well-being. Studies show that many older adults experience post-operative depression, particularly if their recovery is prolonged or if they struggle with mobility afterward. This is especially true for seniors who live alone, face social isolation, or have limited support networks. You might start feeling like a burden to others, or worry that you'll never return to your old self again. These feelings are completely normal, but that doesn't mean you should ignore them. So what can you do before surgery to prepare? Take time to prepare mentally and emotionally. Speak openly with your doctor about what to expect, not just physically, but emotionally. Ask about the typical recovery timeline, common emotional side effects, and warning signs of depression or anxiety. Having this knowledge beforehand can give you a greater sense of control and peace of mind. Don't bottle up your feelings. Talk to family members or a trusted friend about how you're feeling, both before and after the surgery. If you're scared, worried, or overwhelmed, say so. Sometimes, just expressing those feelings can lighten your emotional load. You might also consider joining a support group, either in your local community or online. Connecting with others who understand what you're going through can provide comfort and encouragement during your recovery journey. Connecting with others who have gone through similar surgeries can offer immense comfort, hope, and valuable advice. If you're part of a faith community or social club, make sure to stay connected during your recovery. Phone calls, visits, or even prayer can lift your spirits more than you might expect. And finally, give yourself grace. Healing takes time, and it's perfectly okay if some days feel harder than others. Celebrate the small victories, walking a little farther, finishing a full meal, or simply getting out of bed. Your mindset is one of the most powerful tools in your recovery journey. Staying positive, staying connected, and asking for help when you need it are just as important as any medicine or therapy. Now that you've learned these 7 essential tips before surgery after 71, take a moment to reflect on what resonated most with you. Was it the importance of preparing your body ahead of time, or the hidden risks of anesthesia for older adults? We'd love to hear from you. Please comment below and share one key takeaway from this video that you plan to apply in your own life or with a loved one. Your experience could be the support someone else needs on their journey. If you found this video helpful, don't forget to like, share, and subscribe to our YouTube channel. We're here to support you every step of the way. Stay strong, stay informed, and take good care of yourself. Wishing you all health, happiness, and peace. And remember to subscribe to Healthy Aging Blueprint.